As we are all aware, Australia is experiencing significant skill shortage for health professionals across all the states and territories. To address this growing demand, migration plays a vital role in attracting the overseas trained professionals. So the group of health professionals include general practitioners, medical specialists, registered nurses and wives, personal care workers, the aged and disabled carers, and assistant nursing workers. One of the ways the Australian government is looking to address this issue is to fast-tracking the registration process for internationally trained nurses from certain countries. For example, nurses from Singapore, from the UK, from the US. You would expect faster registration process to enable you to work in Australia quicker. And the initiatives are expected to start from March 2025. So there are various visa pathways available for the health professionals, which can include employer-sponsored visa pathway and provisional or permanent stream, or general skilled visa based on your migration points, or regional employer-sponsored visa, or employer-sponsored visa under the labor agreement stream as well. So if you are aged 45 or above, there can also be age exemption available based on the visa pathway you would consider. So for overseas trained medical practitioners or nurses or midwives, as you may have been aware, you will need to go through a skills assessment or registration process depending on the visa pathway you are going through. For example, for overseas trained medical practitioners, you will have to have your qualification assessed by the Australian Medical Council and to receive your registration before you are able to work in Australia. And for nurses, if you go through the permanent visa pathway straightforward, you will need to go through the MAC skills assessment to obtain a positive skills assessment outcome letter first. Or if you are able to find an employer to work in Australia first, APRA registration will be a mandatory process before you are able to apply for your visa or start working in Australia. So we see larger gap in skilled workforce in the aged care sector due to the aging population in Australia. So we need more aged care workers, including personal care assistants, assistant nursing workers, aged and disabled carers to look after the community. So because those occupations are not on the standard skilled occupation list, the aged care sector industry has negotiated with the Australian government with an aged care labor agreement to support the aged care workers to be able to work in Australia, but they are required to have an Australian employer to support them for an employer-sponsored visa subclass 482 or permanent visa 186 under the labor agreement stream. We understand majority of the medical practitioners are on the standard skilled occupation list. However, medical practitioners may not have straightforward access to a general skilled visa. Because for overseas trained medical practitioners, it may not be the case that you are able to receive a full APRA registration, but provisional, which can potentially stop you from applying for a permanent visa straightforward before you become fully licensed and registered at APRA. So we understand navigating through the Australian migration system can be overwhelming and complex. If you have any questions, please feel free to reach us and to book a consultation. We are here to help you.